to make sure that when they sit for the SBAC in the spring, they're now going to be ready. Right now with this system, because of the interpretation that standardized assessments need to be used, not getting that kind of feedback. And so as a result, we're not ending up being because of the interpretation that standardized assessments need to be used, not getting that kind of feedback. And so as a result, we're not ending up. So that was the reason the recommendation.
This is member Newman. Okay, I'm good now. And so the process is that we approve it and it goes back and walks through the workshop and the hearing, and then we get it as a formal regulation. Okay, I'm good. Thank you very much.
If you're good, would you like to make the motion to approve? Oh, I'm sorry, Member Blakely.
No, I'm
You're good? Okay.
Anticipating.
This is Member Newman, then I'll make the motion to adopt the second set of recommendations.
And Member Blakely, I'll second.
All in favor, say aye.
Aye.
Any objection? Motion carries. Thank you very much.
Pam, you get to get the toughest items. I can't believe it.
All right, we move on to agenda item number 9. It is for our consideration and possible action regarding non-binding recommended ratios for specialized instructional support personnel. We will introduce Amber Reed from our office for a safe and respectful learning environment to give this presentation.
Good morning. This is Christy McGill, the Director of the Office of Safe and Respectful Learning Environment, and I will quickly turn it over to Amber Reed, but I wanted to just quickly set the stage. One is we're really excited to come here before you today to kick off kind of a season of planning. These non-binding ratios and standards, we are matching the national standards as a way to start the process to obtain flexibility for our districts and begin planning processes of how we actually reach those ratios with our districts. One of the feedback we already got was workforce development is a really key issue. So we took that to heart and we went out and wrote a grant from the CASEL, the Collaborative for Academic, Social, and Emotional Learning. And we just received that grant that will allow us to bring people together, not only our colleges and universities, but our districts and also all of our key stakeholders to really look at workforce pathways. And the CASEL National Technical Assistance Center will be guiding us along the way for starting now for the next 12 months. So with that being said, I'm turning it over to Amber.
Good morning, Madam President and members of the board. My name is Amber Reed, and I am an education program professional in the Office for Safe and Respectful Learning Environment here at the Department of Education. The passage of Senate Bill 89 includes a requirement that the State Board of Education provide non-binding recommended ratios. The Senate Bill 89 came out of the School Safety Task Force that Governor Sandoval called following the tragedy in Parkland, the school shooting. The task force recommendations were organized and proposed by 2 work groups, one that focused on physical infrastructure and one that focused on student well-being. And this particular recommendation came out of the student well-being work group. And as you can see here in section 7 of Senate Bill 89, the requirement that the State Board of Education shall develop non-binding recommended ratios for pupils to specialized instructional support personnel in this state for kindergarten and grades 1 through 12 inclusive. These ratios must prescribe a suggested ratio of for pupils in grades K through 12 for each type of SISP. They must be based on evidence-based national standards, and they must take into account unique needs of certain pupils, including English learners. The definition of a specialized instructional support personnel comes straight from federal code and includes persons who are employed by each school to provide necessary services such as assessment, diagnosis, counseling, educational services, therapeutic services, and related services. And this language was, like I said, taken straight from federal code. So this our new state definition, which section 7 of Senate Bill 89 also formalized and codified in NRS is taken straight from the federal definition. And you can see here that SISP, as they're often referred to, include a counselor, a school counselor, school psychologist, a school social worker, a school nurse, a speech language pathologist, a school library media specialist, and any other qualified professional. And you'll note that the recommendations must include information that's based on evidence-based national standards. And there's a few challenges in this. Most national associations for SISP publish recommended ratios. However, there's no one federal entity that collects data on existing or formally adopted ratios. So for example, we reached out to NCES and other folks that gather data for educational purposes, and there's no one clearinghouse for either existing ratios or those ratios that have been formally adopted by other states. Most ratios are per pupil, but some ratios, as we go through each of these in the next few slides, you'll see are per building or per capita of the general population. And there is no formal definition of the other qualified professional at either the federal or state level. The American School Counselor Association recommends a student to school counselor ratio of 250 to 1. The most recent data available from ASCA indicates that the national average as of May 2019 was 1 school counselor per 455 students. And the ratio for Nevada, also published by ASCA in 2017, they estimated to be at 1 counselor per 478 pupils. The National Association of School Psychologists recommends a ratio of 1 school psychologist to 500 to 700 students, and notes that the implementation of the NASP model creates the capacity to make the best, most cost-effective use of school psychologist skills and expertise, which are an existing but sometimes underutilized resource in schools. And I think you heard quite a bit about that during public comment this morning. The School Social Work Association of America, or SWA, recommends a maximum ratio of 1 Master's of Social Work level school social worker to 250 general education students, or 1 school social worker per small school building. School nurses, as recommended by the National Association of School Nurses, recommends 1 nurse per 750 students in a healthy student population, 1 nurse per 225 for student populations that require daily professional nursing services, and then 1 to 125 for student populations that have complex healthcare needs. Speech language pathologists, as reported by the American Speech Language Hearing Association, reports that in 2018, the national average was 52.8 ASH certified speech language and pathologists per 100,000 residents. So this is one of those where the recommendations are per capita and not per school or per student or per school building. They noted that Arkansas had the highest ratio at 84.1 speech language pathologists per 100,000 residents, and that sadly Nevada had the lowest ratio at 26.7 speech language pathologists per 100,000 residents. The National Education Association reports a continuous decline in staff of librarians or media specialists, often due to increases in student populations coupled with reductions in funding. They report that nationally only about 2/3, 66.4% of library and media centers have at least 1 full-time state certified librarian, and that the current estimate of the national average is 1 librarian per 2.28 schools. And I think this goes back to some of President Wynn's comments earlier this morning as well. In terms of the other qualified professionals, Nevada has several special licenses or endorsements, including American Sign Language, audiological services, the ELAD endorsement for English language and acquisition development, music therapy, occupational therapy, and physical therapy. However, there's no recommendation regarding per pupil ratios for these professionals because, as you can imagine, they're dictated by need, the number of students with those needs. As such, the following ratios are proposed as non-binding recommendations for each category of those that do publish recommended ratios from their national associations. For school counselors, the proposed recommended ratio, and again, a reminder that these are non-binding, these are just recommendations. For school counselors would be 1 per 250 pupils in alignment with ASCA's recommendations. For school psychologists, 1 per 500 to 700 pupils in alignment with NASP's recommendation for school social workers, 1 per 250 pupils in alignment with SWA's. Recommendations for school nurses, 1 per 750 pupils in alignment with the National Association of School Nurses. And then for library and media specialists, 1 per school. And with that, we're happy to take any questions. And I'll note that the slide deck does contain live links within the document to all of the references that were cited.
Thank you very much for expediting that presentation, although it is not an unimportant group of specialists that we're discussing. So I would open this up now to the board for questions and comments, and we'll start with Member Ortiz.
Member Ortiz, for the record, thank you, Amber. I have a question. Did the department do an analysis of the current ratios and the gap to get to these proposed ratios and what that would mean as far as dollars to get us there? So if we say the average school psychologist's fully loaded rate is about $75,000. I know I'm probably underestimating that. I'm just using a round number. And because of the current ratios, we need 1,000 more. That's going to cost the state X dollars. Was that analysis done? And if so, what was the financial cost of getting to these ratios?
Thank you, Member Ortiz. Amber Reed for the record. The department has previously done such an analysis with the school social workers and the school counselors, and I'd be happy to provide that information to you. The last estimates based on most current enrollment numbers for the state put an estimated need of about between 1,800 and 1,900 school social workers and school counselors, since their ratios are the same. Based on the enrollment in the state and the numbers of small schools. And so the math, we can get you that number based on the current estimated costs. Those do vary across the districts, however, so we would have to get a little bit more information from each district. But we're happy to do that for psychology as well, if that's something that would be helpful to the board.
And just to know, this is Christy McGill for the record, kind of building the plane as we fly it as well, and why we have also delved into looking at Medicaid to see if that is a potential funding to look for that. So we have been on that journey for about the last 12 months, and hopefully we'll be getting some of that information to you all soon.
This is Member Melcher.
Oh, Member Melcher and then Member Dockweiler.
Thank you. I have a couple questions. Having worked my career as an administrator in schools, this is very exciting, I think, to have these goals set out for the increased levels. School nurses, is it defined what level of degree those school nurses are? Because I know some schools hire a nurse and then they have a nurse overseeing several assistants at different schools. Is that one defined out?
Thank you, Member Melcher. Amber Reed for the record. That is something we can also get to you. The National Association of School Nurses would be the one that would provide that level of qualification of licensing in terms of their scope. I'd also note that each state includes within their regulation scopes of practice for each of these types of professionals, oftentimes through their own provider boards. For example, in Nevada, the Board of Examiners for Social Workers licenses school social workers as social workers first, and then the endorsement comes from the Department of Education following.
Okay, and then my second question is, okay, we get this approved, we get these rates down. I remember that in particularly it was speech and language pathologists were so difficult to find, and we would hire with companies to contract with them. And so I worry about that, and particularly in the rural areas where not only do you need to find them that will work, but also that will move or develop themselves within those rural areas. I'm wondering if there's any plans to work or do study with higher education to see our capacity for developing more school counselors, psychologists, social workers, nurses, and media specialists. and finding out what we need to do with higher ed in order to increase those levels. Because that's, I mean, it's great to have the numbers, but if we don't have the employees, it doesn't help us.
Yes, as Director McGill mentioned, or sorry, Member Melcher, Amber Reed for the record. As Director McGill mentioned earlier, a couple of different efforts. We have the Workforce Capacity Grant that from CASEL to start that work. We've also worked with the NSHE institutions and other private universities and institutions in this state to talk about getting upstream and in fact involving our high school students and drawing them to these fields, especially in our needs, not just in our rural areas, the need to grow our own, essentially, which we've had quite a bit of success with our social workers, but also to move towards more bilingual providers in all of these. That's an important component. And between that and the expansion of the school-based health services in the Medicaid plan that will incentivize the provision of those services and be able to employ and support those providers.
That's great, because I think the potential is there in a lot of coursework now being done online in developing programs that are accessible to anywhere in the state, rural, urban, and while you're working in the evenings and so on. So I think that's really critical, and I certainly would work with you on that if we need to.
Member Melcher, I have a brief comment on that. So Nevada State College just approved their master's degree for speech pathology. And I believe, if I'm not mistaken, they're going to be able to produce another like 60 graduates per year because of that degree. And so thank you for confirming. And so that's one way. And then their School of Education, which is coming online next year, is going to hopefully increase the pipeline of not just educators, but other support professionals as well. So we're working on it. And I think that there's opportunity, to your point, Member Melcher, to work with the governor's Department of Workforce Development to ensure that these careers are some of the careers that we focus on from a state perspective, because they're obviously high need careers. And just FYI, I did the math really quickly. If we just, because I would, Amber, I would like those numbers for all of the positions, not just school counselors or school social workers. If I took that $75,000 number, which I think is still low considering the benefits and healthcare and everything that goes into the fully loaded cost of a resource, it's $150 million, just FYI.
Member Dockwater.
First of all, thank you for this presentation. I also want to thank the individuals who came and spoke during public comment. I also want to share that we as board members received over 100 emails from the school psychologist group advocating for these ratios. Amber, I have some good news to share as well. The National Association of School Psychologists, they now have a mechanism in place that is new this year to track employment nationally. So we'll have a better idea of what those ratios are across the country in the upcoming years. And then also to speak to how many school-based mental health professionals we are short. We're short about 3,500 currently if we're looking at these national ratios. So, and that's counselors, psychs, and social workers. We have a lot of exciting workforce development stuff coming down, which I think is really positive. And I think that there's just a lot of good work going on in this area right now. So this is positive.
Member Ortiz, did you wish to add anything after that?
So that basically doubles our number. So close to $300 million is the need just to pay for those needed resources. So for context, because this is a favorite topic of everyone in the public, our estimated revenue from the marijuana tax this year is about $65 million. So that wouldn't even cover like not even half of the need for just school social workers, not to mention teachers and everything else. Low context.
Any other comments or questions? Member Blakely, are you reaching? Yes.
Yeah. Amber, actually, I'm just going to give you a compliment. I liked very much the fact that you've highlighted all of your references so that they could be, they can be accessed more easily. And I would actually suggest that as this goes farther on, and we're actually dealing with the governor and the legislature, that some of this be retained, this information be retained and used at that time to help persuade the people who actually can make the money available to do that.
Thank you. Any others? So I'm about to discuss this topic, and I want it to be made clear that this is only my personal opinion, unless others care to join with me. This for me is a topic that resonates very much like class size reduction. It is an enormously complex situation, and I'm having a lot of difficulty with it for a variety of reasons. First of all, it grew out of a school safety omnibus bill. And when you talk about omnibus, that's already an extraordinarily comprehensive title. And I know it had to deal with school safety, but we've been hearing from
Sorry for the squeaking. I don't hear anything. Well, they took a break. Man, the thing came back. Let's pause this. Oh, I could be live on YouTube. I'm not exactly sure how that hit. I'm gonna have to pause. Then I'm gonna have to share the screen, get something different, talk about something different. You know, I did download. I need to try to download the while we're here. I can just end this for right now and upload it.